Welcome to the RN to Writer Show. I'm your host, Elizabeth Hanes RN. I used to be a freelance writer, and today I help other nurses discover this fabulous career also. We are excited to welcome today our guest, Elizabeth Morrill. She's an MHS BSN RN and a former ER nurse, currently a nurse writer who specializes in health content for businesses, patients, and healthcare providers. Elizabeth's career has spanned the globe from Bosnia-Herzegovina to Colombia to Guatemala. I can say that one because I live in New Mexico. You have to have some Tarzan Spanish to live here. You can find Elizabeth online at emfreelancing.com. Welcome. We're so happy to have you here.
Thank you so much. I'm so glad to be with you today.
Now, for the audience, one of the reasons that we have Elizabeth on is because her career arc as a writer has been off the charts. In fact, I should ask our office manager, Shelby, to now edit in a big flashing graphic that says results not typical, because you have found rapid and extraordinary success as a writer. And I think the audience could really benefit from hearing about that. So do you mind, Elizabeth, just going through the timeline with the audience of how you went from nursing to writing?
Sure. I have been very fortunate that things have been going pretty well. Right now it's May of 2022, and I started officially in December, so about 6 months ago. But to be completely truthful, this is an idea that had been floating around for a few years. So a lot of that groundwork was happening in the back of my mind while I was taking care of my kids, while we were all getting through COVID. I was dabbling, I was researching, I was reading about it. And then finally, in late last fall of last year, I was like, all right, I'm going for it, all in, everything on the table. So what I did is I put my kids in daycare, which was a big jump because I did not have any income at that moment. So we were having to dip into savings to make that decision. And so there was a lot of, I didn't have another job at the time. It was like, this was it. I had to make this work. So basically the timeline went like this. In December is when I made my website. I revised my resume, made a cover letter, did a lot of your course, Beth. That was when I was doing the majority of my professional development and education. So that was December. And then in January, I gave myself a challenge to pitch 3 times a day, every single day. And I was really focused about this. And I set up a spreadsheet. This is one of the things that you recommend. So I was sending out these letters of inquiry, job applications, everything. I was applying for everything. And with each iteration of these letters of inquiry, I was honing and tweaking and making it a little bit better and reworking the paragraphs. And each time it got a little bit better. And I was applying to literally anything I could find. For me, each time I did this, it was practice. And I had internalized the idea that a 1 or 2% response rate was great. So the stakes were low. It didn't matter if something didn't work out, because there would always be something else to apply for. Well, as the month went on and I was tracking everything, when I sent the letter out, what the response was, what I had pitched, who I talked to, and I had a link to wherever I had heard about the position or the job, so that I could reference it. And by the end of the month, my response rate was around 20%. And I had to stop because I had more coming in that I could manage. So that was when I actually started doing work. And the other thing I did in January is I just focused when I my kids were in halftime care at that point. When I wasn't pitching, I was working on getting my clips. And I did one article on all nurses. I did one for free on LinkedIn, like an investigative journalism piece. I wrote that with your help in your health journalism's course. That was really fun to write. And then my third clip was something from a job board, $50, just, a way to get my name out there with a website link. So those are my clips. And honestly, as soon as I had those 3 clips, all bets were off. Like that's all it took. And it really was just 1 month of hustling. And then all of a sudden I had not just good leads, but like great leads. They were just building on each other. So I started actually writing for clients in February. And let's see, I'm going to pull up, I have the numbers here. In February, I made $675, which frankly, I was thrilled by. And I just checked, I will bill for $9,000 in June. So it's going well. And this is part-time. This is about 30 hours a week of freelancing. May was crazy. So my trajectory has kind of been this arc, and I think I've hit the peak of the amount of work that I want to do. And I've learned a lot about who I like to work for, what kind of work I like to do. And I've actually fired a few clients this month now that I have a better idea of the kind of work that I like. So, but this nice peak is going to carry me over for my new challenge in June, which is to raise my rates and to do a little pivot on the kind of work that I'm doing.
So I want the audience to know that this is nuts even to me. Seriously, like, clearly you should be teaching all of my courses. But I wanted to go back just a moment to the very beginning, because when you say you went all in on this, that was true with RN to Writer too. Like, you got the book and you immediately signed up for the foundational course, which is now called Passion, Profit, Prestige, How to Write Health Articles for Money, and the Complete Guide to Content Marketing Writing for Nurses. Like, you did it all and you worked on it and came to the coaching, showed up, you know what I'm saying? Mm-hmm. I think what's most intriguing, and I'm thinking that, well, first of all, I should have said congratulations. That's way faster success than even I made when I decided to transition over to full-time freelancing. I am suspecting that the question that is at the top of everyone's mind in the audience who is out there right now trying to do this is, where did you find these leads to apply for? Because that's one of the biggest questions I get from people in the programs who are coming to the coaching is, I don't know where to look, and then I don't know how to find contact information. Do you have any secrets you can divulge?
Sure. That was certainly the scariest thing for me in the beginning. And now that I am going back out and starting to market again, there's that little thrill of, oh, is it going to happen again? Can I do the same thing twice? So at my peak, I had 6 freelance clients. And I also want to say that I was doing this part-time, the freelance work. And in the middle of it all, I had forgotten that I applied for it. It was in my marketing blitz. I applied for a full-time job because I was panicking. And they hired me as a copywriter for an agency that does marketing for clinical trials and pharmaceuticals. And because I was just willing to try anything, I accepted it. So that's my full-time job. And that's when I put my kids in full-time care, kind of. And it's really like 6 hours a day. And so that's my full-time job. So I'm doing the freelancing in the edges of it all. And we can talk about that too, what it's like to have a full-time job, because certainly I'm learning a lot about that too. But I'm so glad I accepted that position. It's been wonderful. So with the freelancing, where I find the work is a mix of LinkedIn. I just set up a few alerts and the daily digest would come in and I would just open whatever came up on the list. And I would apply for many from there. And I got memberships to solidgigs.com. And I think the other one was freelance writing gigs, freelance writing jobs. I can check those and share those in the show notes. So those were the ones that I set up alerts for. I found that the paid membership was worth it. They were better leads. Solid Gigs in particular, I thought were good leads. And that was where I found half of my freelance clients. And then the other I got from referrals I found on your membership portal where other nurses were sharing their leads. And I just remember seeing those in the beginning being like, how are people sharing jobs? Like, there's not enough to go around, right? I can't believe this, but there is, and there are. And then, this is another amazing thing that developed out of the your community is back in December or January, somebody posted saying that they wanted to connect with other nurse writers who are at the similar stage in their career, and could we do a little mastermind? There's 6 of us. We have a chat group. We've like done 12 chats this morning between us. We meet monthly over Zoom to talk about our goals, how the month has gone, challenges, and it's an amazing source of support and motivation. And I love hearing what they're doing. We share our websites and give each other feedback. And we share referrals among ourselves, like, hey, this job came up, it's not quite right for me, but would you like it? And we've worked together now, and I've seen their writing. I can recommend them in good conscience. I know them. So that has been another really great motivation and way that I have grown as a writer.
Y'all are blowing me away, because like I had no idea about that. and this is what I'm so pleased, because this has always been my vision for RN to Writer, was a place where it's not just about learning this. It's a community where you meet other people and you do like this. You start your own mastermind group and you motivate each other and hold each other accountable and share leads. And like you said, so many people come into this with that scarcity mindset of there's not enough jobs. There's only so many gigs to go around and I'm going to hold mine tight. And it's not true at all. And my personal experience has been, actually, the more generous I was in sharing, it felt like the more leads came in. A weird synergy sort of thing of freelancing, I guess you could say. So that is fantastic. And I'm so happy you shared that also, so that I know that this came out of, that would be the Success Society community that comes with the content writing course. Mm-hmm. That is wonderful, wonderful. I wanted to ask you, I also wanted to say that I'll throw in a little promotion for something new that's going to be happening to facilitate more of that networking. Is Charlene Lucas, who is a nurse writer, is going to be hosting weekly Zoom events called Health Writer Happy Hour, and RN Writer is going to sponsor those. But I'm not going to be involved. It's going to be strictly for networking of health writers who are nurses or otherwise. Even if they're not involved with RN Writer, it's going to be open to the public. So we'll be publicizing that on rntowriterdaily.com, and I hope people will look for that and show up, because I think networking is one of the keys to making this work. I mean, I made lifelong friends who were other nurse writers when there weren't that many of us, and we always shared leads and just were there to vent to and give pats on the back and stuff. So I think that is wonderful. Now, I also wanted to circle back for a moment to say, you said you're doing 30 hours freelance and you're also working full time. So I can hear people going, aha, yeah, see, 70-hour weeks. I'm not too down with that. But I wanted to let those members of the audience know that it wouldn't have to be that way. Like, you're doing this by choice, because you just said you're billing $9,000 a month freelance. So certainly you could do that full time, right?
Yes. May was crazy. I didn't like working that much. I'm glad I did it, because the clients that I found I liked working with were not the one. I mean, all of them were wonderful. Like, don't get me wrong, but my favorites weren't the ones that I expected to be the favorites at the beginning of the month. So it was absolutely worth trying it and finding out what was a good fit. And what I walked away from is that there's really 3 things I'm looking for in a great freelance gig. And I have to love the work. I have to think it's quality work that's going to help people. It's not enough to write clickbait. It's not enough to write something that, just for the money. I need to feel like this is actually helping other people with their health literacy, or to access things that will make their lives better. And I have to be able to back up what I'm saying. I need to be able to have the long form room to cite and connect to reliable sources. That's really important to me. There are a lot of writers out there. There are writers who can do those things. As a nurse writer with who values the science behind all of this, I've found that that's important to me, and that's what feels good. So that was the first sort of, if we're looking at a Venn diagram, that was one circle of it. And then the other is I have to like who I'm working with. I need to have a good relationship with the editor, with whoever the process flow is. I like working with established clients who they have this process flow down pat. They bring in their writers, they have a regular pay date, they have regular onboarding set up. It's really easy. I get my assignments, and then it's kind of hands off until I turn it in. That's great. I love that. Especially because my life is a little crazy right now. It's hard to nurture the ones who need more touch points during the week. And for other people, that could be just fine. And they like that connection. But for me, I kind of need more of a hands off just for this phase of my life. And then the third part is the money has to be worth the time I'm taking away from my family, because that's what it is right now. Every job is an hour that I could be doing something else. So I've come to value my time more than I did 6 months ago. So the perfect client is the one that falls right in the middle. And I still consider myself very new. So I'm willing to sacrifice one of those circles for now, but not for much longer.
Well, you might be new, but you are absolutely slaying it. I hope the others in your group in your little mastermind are as well.
They're amazing, and they all have their own area of focus and expertise. And here's another cool thing that we did back in the beginning when we all were still trying to get our clips. So, and this is why, like, it's hard to say, yes, I've been doing this 6 months, but I tried a lot of other things before I landed on freelance writing. And one of the many, many things that I tried was blogging, trying to do like a mommy blog. And I decided that, this just isn't quite the right fit, but I love being my own boss. I love writing. I learned how to do SEO articles. I learned about affiliate marketing. I learned about guest posting, all these different aspects of online work. But like the topic wasn't quite right. And I remember I walked away from that blog and all the time and money and effort that I had poured into that, thinking, oh no, what a waste. But the truth is, like, that was my education, because I can write an SEO article. And so one of the things that we did in our mastermind is when I was trying to get some content on my freelance blog, as I said, would any of you guys like to write for me? And so as a exercise for myself, I developed a protocol, like a checklist for writing an SEO article for my blog. Like, this is what I would want it to look like. And it was really just a test for myself. Can I develop SOPs? And so I invited some of the other nurses to write for me. And then it was great. Like, I got to see how they write. I got to be intimately familiar with the topics that they liked and what their strengths were and what motivated them. And then I got content for my freelance blog, and it looks like I have this really established freelance blog. So that was a really great way for all of us to get content and clips.
I'm just, people who watch this show or listen to this podcast know I'm never speechless. I'm just speechless. And I'm, again, just blown away by how you all are out there. You're taking this concept and you just are running with it and doing it your way and making it succeed on your terms. And to me, that is the truly great thing about freelancing, is making it fit your lifestyle instead of making your lifestyle fit your nursing job. I wanted to thank you also for the information about the paid job listings, because I historically have dissuaded novice writers from going that route, because I didn't think that it was worth the expense. But everything evolves. And it's been 10 years since I even thought about doing that. So I really appreciate getting the updated information that those can be worthwhile. And we'll definitely put the links to those in the description or the show notes so that everybody else can go investigate those too. I will go investigate them as well, even though I'm not writing right now.
There are a lot. I can think of a couple that I didn't even. Indeed was good. There are a few Facebook groups that I joined where editors are on there posting, and like, good jobs, 50 cents a word, $1 a word. So they're out there, and it's just kind of compiling that list. And some are free and some are paid. I I think I wish in retrospect that I hadn't gotten an annual subscription to those sites, because I don't need it every month. So I think month to month would have been fine. That would be my only advice.
That is awesome. Thank you. And we have to wrap this up, sadly. We'll have to have you back. But is there any other final piece of advice you would like to give audience members, particularly those who are either they have not started, they're just sort of thinking about this and wondering, is this a scam? We get that a lot on our Facebook ads. This has got to be a scam. And I'm like, no, not really. Or they're just starting out, but they're struggling. What advice would you give to those people?
I think there's two takeaways that, because I have been working towards like this moment for so long, much longer than just 6 months. And I think the biggest thing that has held me back has just been my darling, sweet, wonderful children. And it's just, for me personally, I tried for years, my kids now are 7, 4, and 1, to have some sort of part-time work with my kids home. And it was not possible for me. I tried everything, waking up early, staying up late, writing during nap time. It never worked. I could never get those reliable hours uninterrupted together to make progress the way I wanted to make progress. And I had to finally just put them in some sort of childcare. So when I finally accepted that, just because other stay-at-home parents were able to have the at-home business with their kids underfoot, it wasn't going to work for me. And I have to say, I'm a better mom now that I have this split. So that is one thing. If you're thinking about investing in some childcare to help you launch, I don't think there's any guilt in that. They're happier because I'm not so stressed and trying to type while they're watching like the 12th Paw Patrol in a row. So childcare is yay. And then the other thing is that all the steps along the way that made it possible to be successful now, to me at the times, they felt like failures. So my husband's in the Foreign Service and we move every 2 to 3 years, and they're hard moves. We go overseas. We often live in temporary housing for months at a time. Internet can be unreliable. They're difficult and challenging moves where we're constantly starting over. And when we move, I never know what is going to be possible there. And I have tried so many careers over the last decade. I have been a doula. I did all the 95 hours required to become a lactation consultant. I worked in HR. I was a secretary in the embassy for a while. When I was 28, found a internship program for college kids and joined it and went and worked in an ER in Medellin and learned Spanish. It's just being open and always trying something new. I mean, I've worked vaccine clinics. I've did like proofreading for a medical writing company in India. And it's just constantly not giving up and iterating over and over and over and taking something away each time. Like, all right, this wasn't quite the right fit, but what worked? With the blogging, all right, I like writing. I like being home. I like being my own boss. With the doula work, I like helping people. I like being there for them for important moments and being a part of that health literacy and education. There's something there. And altogether, that is why I can now have a resume as a health writer and say, hey, guess what? I know a lot about breastfeeding. I can do women's health issues. Like that was not something I had ever planned. And each little step along the way, there's a lesson in it and something that can help you be successful here.
Absolutely. I think that is such a wonderful point to end on. The way I put it is the way I put it in the coaching sessions when people are feeling a little demoralized is I tell them everything is a data point. Part of the skill, I think, of succeeding as a freelancer is learning how to not take things personally, because it's all a data point. If it works, that's a very positive data point. But if it doesn't work, that's also a positive data point, because now you know that doesn't work. It's sort of the Thomas Edison approach of, I didn't have 9,000 failures. I eliminated 9,000 options that didn't work. And then I finally got to the one that did. And so if you're out there getting started in the audience and you have those moments where you're feeling demoralized, remember, it's nothing personal. It's just data gathering. And you can do like Elizabeth does and like I do, and just categorize that data so that you can then tweak your approach or whatever you need to do. The more data you have, the more you can refine your approach, the more successful you can be. So I would like to thank our guest today, Elizabeth Morrill. We should have you back in about 6 months to check in and see how things are going, see what else you have learned, and see how high flying you are then. That would be awesome. And thank you also to the audience today. You've been watching or listening to the RN to Writer show. You can find us on YouTube. Don't forget to subscribe. And you can follow us on Spotify and Apple Podcasts. Until next time, keep pitching.